Welcome to another week of Antidotes, Stories in Medicine. This is Christine. I am so happy to have you guys back. Thank you for everyone that has been interacting on Facebook. Thank you for everyone that's been leaving reviews. The Facebook group keeps growing and growing, which is so exciting to see. So I like to bring you stories from, of course, all over the world, but there's a lot of stories from people that have been in my life throughout the years. And I have found that there's a lot of podcasts when it comes to medicine that love to talk about doctors and the crazy things that doctors have been doing and how they have come from these amazing establishments that are pillars of the medical community. And they are kind of in these ivory towers doing this really incredible cutting edge research. And those are great stories. But the stories that I like to tell are the people that you see every day in medicine when you work in it, the people that interact with you if you were a patient, the nurses, the EMTs, your speech language pathologist like Annie. But every once in a while, I want to tell the story of someone that has been kind of on the other side. Like we heard with Dan, the reason that we all got into this is so that we can help other people. But if we're not ever listening to the people that we're trying to help, or we're not ever taking into the perspective of the other side, we don't really learn that much, and we kind of forget a lot of things. And it's really important to see why we're doing things and what it means to be on the other side of kind of this great big chasm of patient versus provider. And whenever you have a family member that goes on to that other, becomes the patient, or you yourself becomes a patient, you learn a lot more about this field of healthcare. And I remember years and years ago, I had a bunch of friends, and I was told about this friend of theirs that was really sick in the hospital. And to the point of this girl was in the ICU, and they were doing tequila shots every night at 7:00 because she was so sick. And they had to stop doing them because she was so sick for so long. And they would ask me what I thought about her case. And being an EMT at the time, I was very reserved and didn't know anything about it. But turns out it was a pretty incredible story. And I want to go into that story with you. But she talked a lot about what she went through and how she received a heart transplant, and she just talked a lot about her experiences. And there's a couple of things that kind of stuck with me as I have been practicing medicine, and it's just something that I would not have known having not known the story. So I would love for you guys to hear this, and it's just really incredible. So this is a good friend of mine, Elissa. Welcome, Elissa.
Hi, thanks so much for asking me to come on and talk about my experience and my story and all of that. Tequila shots. I know it really got to a point where I was telling them, like, please no more, please stop. Like, you guys are not gonna get sick.
Well, I think for part of the tequila shots, you weren't telling them anything because you were in a coma.
True. And I always kind of forget about that whole part because, like, I really wasn't there. You know what I mean? Which is like that's kind of the most, like, I guess, medically interesting part. And, like, I have zero insight. I have, like, no I have no timeline. Like, I'm like, I was here for a couple days and here for a couple days. Don't really know. Like, but I know that's kind of when, like, it was pretty bad. Like, I died a little bit. Like, honestly, like, they had to.
But, like, literally.
Yeah.
Not like, oh my God, I died when I found that out. Like, no, you actually were dead.
Yeah, for a little bit. Yeah, they. I know my husband tells a story about kind of those early days where a doctor came to see them, and they were talking about that this doctor was up on the operating table, like, with his hands in my chest, trying to get my heart to beat, and my husband was just staring at his scrubs, which were covered in my blood.
Oh my!
And he was like, "Wow, like, this is getting real, like, this is pretty bad."
Yeah, and Jay's not exactly a wilting flower. He was a Marine in Afghanistan,
I mean,
twice.
He's not. Yeah, he deployed. He was in Afghan in his final deployment, but I mean, that was long. Not as lean, not as mean.
Yeah, but still, like,
yeah. He's not like a Girl Scout. No, I mean, no offense to the Girl Scouts, but
oh, my nieces, when they're vicious.
Yeah, I know. I'm like, oh no, I'm gonna get poisoned Samoas from now on.
So we're kind of hinting at all the juicy parts, I guess you would say.
Yeah.
Someone in your chest. How old were you when this happened?
So I was 25. This was the summer of 2013. I was working like a temp office job. Like I didn't really like it. I was going to yoga every day. I was probably healthier than I've ever been in my whole life. Whole grains, gallon of water every day, low sodium everything. And then I caught this like stomach flu thing, just, worst case, both ends, awful.
Yeah.
And that virus mutated in a certain way that started to attack my heart. And what made us go to the hospital in the first place was I was home, I was Tuesday or Wednesday, I'd been calling out of work, which sucked because I was working temp. So if I didn't work, I wasn't getting paid. I was stressed out about that. Like I was just watching TV and I started fainting, and it just felt like I would blink and I would open my eyes and like, I was watching TV and it's like, all right, clearly that's it. That happened longer than that blink supposedly took.
Yeah.
So I was texting. I mean, I was my boyfriend at the time, my husband now. I was texting my husband like, hey, I think I finished it. I assume I'm just super dehydrated. I haven't been able to keep anything in me for, I think I at first felt sick on Sunday nights, like 2-3 days. So he's like, oh, we'll take you to a minute clinic. We'll get you an IV. Like, and I'm like, oh, no. Like, I'll be fine. But once I started, passing out, he was like, no, like when I get home from work, we're taking you to the ER.
Mm-hmm.
So he gets home and he works 8 to 4, not 9 to 5, which is one of these things that sort of grand scale is like, because, well,
yeah,
we'll get to that. But
yeah,
he gets home about 4, takes me to the emergency room. I check in, I'm feeling very sheepish. I'm like, oh, like, no, I just have like a tummy bug. Like, I think I'm just super dehydrated. Like I had a little faint, at home on the couch, and, they gave me the clipboard, gave me a wristband, told me to sit down. And then I started fainting as we were sitting, like more frequently.
Mm-hmm.
And they dragged me right back. Jay, my husband's name is Jay. Jay said that it looked like I was having a seizure. And his father gets seizures, so he kind of like knows what that looks like. So at this point, he's starting to really panic, and I'm still just like, I don't understand what's happening. Like I've never been this, like,
yeah,
like you get sick, you throw up, like you shouldn't be passing out. You know what I mean?
No, and you shouldn't have seizures either.
Exactly. Yeah. So they pulled me back. I remember they hung probably 6 bags of saline, and they were just, because end of the day, I was dehydrated. They had an EKG on me there, and it was like, it all seemed kind of normal. But I think they were lucky enough to get, and I don't know if I'm getting it right, the EKG is that what you like normally do first? Yep. Okay. That I kind of had one of these quote unquote fainting spells while they were doing an EKG, and again, just lucky that someone in that ER had kind of seen this before and knew what was going on. And it turned out to be viral myocarditis. Is what the full name is idiopathic viral myocarditis, because they don't know why this happened, or like kind of generally why it happens to begin with. But yeah, he kind of figured it out, that one doctor. And if I was better, I would know his name, but I don't. My husband worked at South Shore Hospital for a little bit, and he ran into that guy several months later and was like, my wife is okay, like you saved her.
Oh my God. So this was at South Shore Hospital.
He first took me to South Shore, yeah. And that's where, at South Shore, was where they were like, all right, we think it's this, myocarditis thing. We're not sure really what's going on. We're not really equipped to this.
Okay.
So the last thing I remember clearly is looking at all the saline lines coming down and seeing all the bubbles in the lines and being like, oh boy, like that's me. You're not supposed to have bubbles in the lines. I'm going to die. And then my story kind of ends there and picks back up about 10 days later. But what happened after I essentially passed out, still in that kind of triage area, is they put a temporary pacemaker in And I think possibly did something else. But like I said, my husband says that I was speaking to him after they put the pacemaker in, saying that I felt great. And I'm like, I don't know, man. I guess that's dilaudid for you. Like, I don't remember any of that.
So your heart was stopping?
Yeah, it was. So myocarditis is your heart essentially swells up to the point where it's too big to beat within your chest. So I thought I was fainting because I was dehydrated, but really it was a case of my heart was too big to pump any blood into my brain.
That sounds like a problem.
And again, yeah. And again, just like lucky me, I was never like without blood in my brain for a long enough period to like severely impact. Like, I mean, I'm walking, talking, like nothing is essentially like, I feel like I'm getting stupider, but I think that's just, everyone kind of feels like that once you leave school.
Yeah.
So after the pacemaker was put in, I got a med flight ambulance from South Shore up to Boston.
Now, were you driven or flown?
Well, I think I was just driven.
Okay.
I wasn't, like I said, I wasn't really like there, but I'm like 99.9 that it was a ambulance.
But it was Boston Med Flight, because Boston Med Flight does ground critical care transport, but also air critical care.
Yeah, because I think just at that point, the equipment I needed to like keep me alive was more than South Shore had kind of ready to go, and like more than I guess would be in a helicopter. I feel like if I was in a helicopter, because my like, you know, my husband, who was a Marine, was a helicopter mechanic, so I feel like if I had been in a helicopter, like I would know about it by now.
Like, they would be all on it.
Yeah, that would have been like a little trivia, like, you were in a helicopter, you know.
You would know like the type of helicopter.
Oh my god! Oh yeah. Yeah, it was an Apache, like. So let's see. So we get to
Boston Children's?
I assume they first brought me to Brigham and Women's because they wanted to put me on an ECMO, and then they didn't have enough at Brigham, which is why I had to go to Children's.
So explain what ECMO is for people.
I don't know what the acronym stands for, but it's more or less a machine for your circulatory system in your lungs. So you get kind of plugged into it. Mine was femorals and one in my neck, I think. Mm-hmm. And it just sort of does the oxygenation of your blood for you.
Yeah, it's.
I think like this again. I really wasn't. Yeah. I can talk about the BiVAD all day. Like I know about the BiVAD, but the ECMO, I'm like, I think I know that's it's more of an open system, so it's a little less. It's a less stable device than the BiVAD, but just at the time I wasn't breathing on my own. Like I was, I had intubated the whole nine. So it was like, that was what I needed at that time.
Yeah. ECMO is extracorporeal membrane oxygenation. Basically, like when your heart can't pump and your lungs can't work for you, this machine does it all. It's super bypass.
Yeah. Don't Google it. It's terrifying.
It's very interesting to Google if you have not had one. If you have had one, do not Google.
Yeah. If you're on the list for a heart transplant, don't look up the Wikipedia page. There's a picture of just like an open chest. It's awful. You don't need to see it.
Yeah, I always tell patients don't Google things.
Yeah. You just can't help it sometimes, though.
Oh, yeah, of course. So Brigham and Women's Hospital did not have enough ECMO machines.
It was they keep one or two just essentially as an extra, and they had enough people that were just on them that they didn't have enough extras to put me on one. Is kind of the impression I got.
Yeah.
And I mean, I was only 25. I think Children's typically is 21 and under, but it's like, I mean, whatever. Like, I need the machine.
Close enough.
Yeah.
It's such a significant piece of equipment that hospitals don't have like a lot of them kicking around.
Yeah.
Basically. Yeah. And Brigham and Women's Hospital and Children's Hospital, for people that don't know in Boston, are basically these shared hospitals.
Yeah. They're literally connected.
Yeah, they're connected by like this bridge. And so like I've done rotations at these hospitals, and women will deliver at Brigham, and if they need specialty pediatric NICU care, like their child can go to Children's. And there's a bridge that the doctors and the moms and everyone just walks back and across. Yeah,
it's like lit over the street. It's like on the second or third level of the hospitals, and you can just walk all around. It's connected to Dana-Farber too, the cancer center.
Yeah, it's this huge complex at Longwood Medical Center. Mm-hmm. And BI, Beth Israel's right across the street, although not connected. So then you get to Children's, And what happens now that you're reported about? Obviously, you're unconscious, so you're chilling out.
Yeah. Well, I know that I was having kind of opposite issues. I was bleeding too much, but I also had a blood clot. So they were giving me both anticoagulants and I don't know, you'd call it like a anticoagulant to kind of deal with both this like excessive bleeding and the clot. It was in one of my legs, and it got to the point where they were like, if we don't get this rolling, if we don't get this clot figured out, like she might lose a leg, which is pretty effing scary. And like I feel like thank God it didn't happen. I think that was part of the decision to transition me from the ECMO to the BiVAD was BiVAD. It's less likely to clot than the ECMO, if I'm remembering right again. And then also it's a little more closed, so there would be less of an issue of excessive bleeding. So, because I feel like most of your listeners probably are fairly up on their medical knowledge, but blood should be in your body.
Not everyone's medical. I mean, some people are just like, I like cool stories. So, yeah. I mean, I always try to talk to as if people are not medical, and because also like I don't work with ECMOs and BiVADs in my regular day-to-day. Like if you want to talk about diabetes management guidelines, I am your girl, but I don't work with BiVADs. So, I mean, explain to me like I'm two, because I don't know.
Yeah. So they decided to switch me to the BiVAD, which is a ventricular assist device. I think what VAD is, and then bi means used to. Typically, I know a couple of people who have had just the LVAD, which is just for the left ventricle, but since my heart was just so, it just really wouldn't do anything in there, so they did the both sides. And the BiVAD, similar to the ECMO, is it circulates your blood.
Yeah,
it's a continuous cycle, so kind of interesting. You don't have a pulse while you're on the BiVAD. Which I had at one point I had some like peripheral numbness, so they sent in a team of neurologists, and they spent realistically probably a good 15 seconds trying to find a pulse and like looking increasingly concerned. And like I was awake enough to kind of know what was going on at the time, so I was like, I'm just gonna go ahead and let them have a little fun before I,
I love the idea of you just sitting there, just tooling on these Harvard children's neurologists, being like, "Yeah, okay, you go find a pulse there, buddy. I'm on a private."
Yeah, right. Like, knock yourself out. Try my feet. Go ahead. Try my feet.
Look, here's a hand. Find a radial.
Yeah.
That's actually, it's a really good teaching point for people. We had a couple of patients when we were in EMS that we actually knew who they were because they had BiVADs or LVADs. And because they're like, hey, if you ever go to this patient, don't try and find a pulse. Don't put them on an automatic defibrillator because it's going to try and find, certain things and you won't find a pulse.
There's a Netflix show where a character has an internal VAD, and there's a scene where his girlfriend goes to wake him up and like can't find a pulse and freaks out, and he wakes up and he's like, "What are you doing? I have a heart machine," or whatever he says.
Yeah, don't do CPR on them because they have a BiVAD.
So I'm on the BiVAD now. They've pushed me back over to Brigham and Women's. They're starting to kind of lower the propofol that I'm on. I'm coming out of it. And at this point, like, all I know is that I passed out at South Shore Hospital.
And then you had been actually unconscious for about 10 days. You in a coma.
Just about, yeah.
Okay.
Yeah. And so propofol, if you don't know, is kind of known for giving you like terrible, awful nightmares. And I won't go into it, but it's true. So like the first several days were like just trying to figure out like what was real and what wasn't, and like what had actually happened and what didn't. It was like very confusing. Plus just trying to figure out like where the fuck am I? Like,
right. You told me something and this is the thing that has always stuck with me, is you said when you woke up in the ICU, you were so disoriented and you had no idea what had happened to you, that no one kind of told you what was going on. They just, they were very brusque, and you were like so terrified and just like, what the hell? And people kind of just started doing their exam on you.
Talking over me.
Talking over you. It was talking to you like you had known everything.
I think perhaps the medical staff was under the impression that like my parents and my family were talking to me, because I mean, they essentially moved in. They were like, every time I opened my eyes, like my parents would be at the foot of my bed, or, my husband or someone would be there, which was great. But it's like, I didn't get a chance to like ask any questions about, like, what the fuck?
Right.
Because and then this is kind of just me as well. Like, just with my parents sitting at the foot of my bed, just like weeping, and my husband like white as a sheet. I'm like, I kind of felt like I almost didn't have, it made me uncomfortable to be like, what happened? Because I didn't want kind of them to hear it all again. But then they weren't telling me what had happened. So,
right.
And I think my dad, I think, might have been under the impression that like I was able to like hear them and understand them while I was under, which is, he claims that, I'd squeeze his hand when he'd say, squeeze my hand if you can, whatever. But I'm like, I was having my like propofol nightmare. Like, you weren't there at all. So, and that's the thing, like, I may have registered, that's the thing, I don't know. I don't, but I don't remember like hearing those folks, which again, like, yeah, like you said, I woke up and they're like, they're just kind of rolling on with their day, like tapping out the IVs and switching things out, and like, oh, it's been 3 days. We need to well, actually, no, I've had a neck thing, so they weren't switching my IVs yet.
Yeah, but a central line. I think also maybe I see family members just like, oh my God, they recognize me, they squeeze my hand, and it's a comfort for the family members. But that's such a great point to be like, one, for family members, don't assume the patient, if they maybe even subconsciously recognize your presence, they're not like,
oh yeah, definitely.
Yep, this is a dinner conversation of, oh my God, isn't this shit crazy? Like, that's not that same level of interaction. It's a very important interaction for the family member, and it may be an important interaction for the patient, but it's not that same level of interaction.
It's not something that like, and that's the thing, I may well have like heard the voice and been comforted by the tones and squeezed and done whatever, but it's like, it didn't stick. Like, the medications, the drugs you're on, like they prevent you from creating those memories. Like what fentanyl kind of does that, and which is the point. So like, you don't remember this awful, terrible thing that's kind of happening to you.
Right. And I'm sure maybe your family also, I see this a lot, and I don't want to make assumptions, but a lot of times family members say, oh, I don't want to bring up the event because, oh, she's got a weak heart. I don't want to, like, it's like that old, like, I had a 40s movie thing, like, we don't want to trigger her heart again, like, by bringing up all these terrible things.
What they would tell me was, what I heard a lot from my dad was, he would lean over my bed and go, Liz, the hard part's over.
What does that mean?
I'm like, I don't know I don't know what happened to me. Like, I don't know what the hard part was, bruh. But I'm like, at this point, I'm just struggling trying to brush my fucking teeth, man. Like, I don't know what you think the hard part was, but like, I had to learn how to walk again. Like, that's not, I wouldn't call that the easy part.
Yeah. It's so funny about the things that we think are reassuring, but when you have no concept of what the other person is going through, you're like, what the fuck is wrong with you for saying that? And of course, it is such a well-intentioned statement from your father.
Of course.
And it kind of reminds me of for other listeners who were listening to when Dan was telling his story about the guy that was helping out when he got blown up, and he was like, you're making your country and your family proud.
Oh
and
my
like,
God.
Shut the fuck up. Yeah. He's like, you're really being annoying. But it's like a well-intentioned statement, but not helpful. So you have to really be conscientious of.
Yeah, I think as like a friend or family member, just like keep it present tense. Like, how are you feeling? What can I bring you now? Like, what do you need now? How are you feeling now? Because it's like, I don't know what the hell happened last week, and it's not relevant right now to like, me eating my breakfast. Yeah. You don't know how you act until you're in a situation like this. And my parents never practiced, oh, what are we going to do if our kid, is on life? Like, you don't really, they were just trying to keep it together as they can, and they were behaving.
Yeah, you don't run those drills.
Again, yeah, you don't practice. But yeah, I would avoid like the hard part's over unless the patient has made some suggestion that the hard part's in review. So now let's say I'm on the bed. I'm at Brigham and Women's.
Yeah.
And I don't know if it was like a blood pressure thing or just being out for so long or whatever it was, but like my vision was super blurry for maybe a week or so when they first woke me up. So like they have a big whiteboard in the room that says danger nurses and whatever. Like I actually didn't know that I was intubated for a while. People couldn't understand me when I was speaking because I had a fucking tube in my mouth. That's the thing. Like I assumed they were like, you have something in your mouth. They don't tell you because they don't want you to freak out. I had the little cuffs on too. I have real memories of that. But I know that Jay and I both know at least the alphabet in sign language, so I was kind of spell things to him, which was such a savior because I couldn't hold a pen, like I was weak, and I had the little cuffs on, so I couldn't really even move my hands that much, but I could still make letters, and I was spelling people's names, asking about, actually, yeah, one of my favorite stories about this whole thing was right in this period of time where I'm like very foggy, very fuzzy. I don't quite know what happened. I don't know how long it's been. Like, I don't really know what's going on.
Yeah.
I'm spelling stuff to Jay, and I keep spelling dinner. And like dinner, like, are you hungry? You can't feel like, oh, you don't need to eat now or whatever, because I had the NG tube. And are you asking me what I have dinner? And I'm like, not. I'm like, yeah. I've been in coma for a week and a half, and the first thing you think to ask is if I've eaten dinner. Yeah. So that was actually the last line of our wedding vows. I was like, oh, and I promise to make sure you always have dinner. Yeah.
Your wedding was so beautiful.
Oh, thank you. It was a pretty good time.
It was a great party.
Thanks.
It's so interesting, like, because we think about, update the whiteboard, and like nurses kind of roll their eyes at it because like, we think it's so stupid. But like, yeah, I mean, even though you really couldn't see it, but the whole point is like, this is today, the point of orienting the patient. Yeah. I mean, I guess you would think like, I hope they would have said you're intubated, but again, it's hard.
And that thing, if they did, it might just not have stuck. You know what I mean? Like,
right.
It's possible that everyone was just shaking, be like, you have a fucking tube in your fucking face, stop talking. But I just don't remember. Yeah. So, sorry for the F-bombs. I don't know what this is rated, but...
Oh, it's very explicit. Don't worry.
Okay. All right.
A lot of swearing. So...
Damn shit hell.
Get it all out. How long were you intubated for? Was it until you got the transplant?
No. Thank God. It was so here we are. So I had developed some sort of infection along the way, and they didn't really know where it was. So while I'm on these necessary tubes, like, I couldn't eat. I had the NG tube. I couldn't breathe. I was intubated. I had oxygen. Pick an orifice. I had a tube in it and then some. Yeah. So because of this infection, they wanted to kind of get as much stuff out of me as possible. So I think like I got screwed out of, a couple extra days on the Foley cath. I had to start rolling to pee. And I just remember there was something in, I don't know if it was the central line or whatever, but I remember having like hold my breath and hum while they pulled something out. You know what? They tried to take the tube out, but I freaked out because I had some pneumonia. And I think it wasn't, I feel like I remember them telling me that I had pneumonia or like a mild case. And then they unintubated me. And I couldn't breathe, like I couldn't take a full breath because I had pneumonia, and I was like freaking out. They tried to CPAP, tried to BiPAP. It was awful. And again, this is still in this period of time where I'm like, I don't quite understand what has like gotten me to this point. Right. So yeah, just like this is the most scared, feral, wild animal you can imagine who can't take a full breath.
Yeah, or what all of this equipment is, because you're not.
Yeah, I asked them to put it back in. I asked them to intubate me again. And they brought the doctor in, and I was like in a sheer panic. I was like, I can't breathe. Like, please put the tube back in so I can fucking breathe. Right. And he's like, no one's ever asked to have to be re-intubated.
Oh.
Yeah. And that's the thing. I think this happened kind of in the middle of the night, but it might have been the middle of the day. Like, I just remember it being a dark room, so I don't know if the curtains were drawn or if it was actually nighttime, but just chaos. But they did put it back in. And obviously I fucking calmed down, and I think they had it in for another maybe day and a half or 2 days. And when they took it out the second time, I think I was a little more prepared for it. So I didn't lose my mind to the same degree, but that was good because they took out the breathing tube, but I still had the NG tube. And that was kind of a fight to get them to take that out because, I wasn't eating a whole ton, because I was traumatized.
Yeah.
But it's like, it's hard to eat with the NG tube. It feels like, you ever gotten like a piece of spaghetti stuck in your throat? It's that same exact sensation, only you can't swallow it and you can't cough it up.
Oh, yeah.
Yeah, yeah. You just have spaghetti in your throat all day and all night.
Ugh.
Yeah, yeah. So, and that was weird because eating with the NG tube, it's like you really get that sensation of like, oh, I'm choking on something because you kind of are, like it's in there.
Right. Yeah. Yeah.
So I bitched about it enough that one of my nurses like, you want it out? Let's take it out, and just pinched it and like yanked it out right then and there. So she's like, you better start eating. I'm like, okay.
Yay for feisty nurses.
I know. It's like, be careful what you wish
Fine.
for. Like, okay. And then yeah, just so I messaged you a little while ago about something that happened that I think I was still intubated. So it was my surgeon came in to kind of check up on me and like just see how things were going, see if I was stable or whatever. And it was I remember the nurse for sure. It was Dana was her name.
And this is Dana at the Brigham?
Yeah. 6th floor. I don't know if she's still there. I think they kind of come and go, but
well, if there's a Dana that's an RN on the 6th floor at Brigham and Women's Hospital in 2015, you said?
2013.
Okay. So this would have been March 2013?
No. March is when I thought it was. This is July.
Oh, I'm sorry. That's right.
Yeah.
July 2013. All right.
So
let's see if we can find Dana.
July, August. So the surgeon comes in to check on me, and I kind of like start like making eyes at Dana, like, hey, it'd be funny. And I reach over and I'm like pretending to pinch the surgeon's ass and like smack him, and like she starts laughing. I'm like laughing as best as you can with it, tube down your throat. And the surgeon is just like, he's this very like straight laced, like bow tie type, just like very sweet older man. He's like, he turns around from my giant like 3x5 stack of IV pumps. And he's like, what's so funny, girls? Which has just made the whole thing even, like, we were beside ourselves, like, in tears laughing and just, like, pretending to grab this, like, respected surgeon's ass. Like, oh, you want to save my life? Honk, honk. Like,
I'm going to be a 12-year-old boy.
Right. And I'm not sure that he ever got to the bottom of why we were laughing so hard that morning or evening or whatever it was, but
you have to have moments of levity and something like that.
Yeah, and that's like that was when she kind of told, when we were retelling that to my husband, that's one of the moments where they were like, I think she'll be okay. So make it funny, like make it somehow manageable to live through, and if that involves like pretending to assault your surgeon, then I mean, so be it. Like, I still think it's funny. I still laugh about that when I remember it. And yeah, that was still like pretty early days. Yeah. Rolls right around. I'm still in the biped. I'm figuring out how to eat, brushing my teeth. Oh, the first time I got PTOT to come in, they hand me one of those like school picture day combs.
So you started PTOT.
You don't really think about like, because even if you take the world's most relaxing 10-day vacation, laying on the beach, like you're still going to be up and like walking around and moving. Like you don't realize how much you could lose in 10 days if you're literally just laying in a coma. Right. So I know I was all puffed up, swollen from, extra fluids and everything. But once I got back down to like, I guess just meat when you get all the fluids off, I was real skinny, real weak. Like I just brushing my teeth was like a victory. Yeah, just because you start like you just kick your feet off the side of the bed and you kind of lean over and that's it for that day. That's day one. Yeah. And then you put a little weight in your feet, but then you just sit right back down. It takes a few days to like even stand up again, and it takes like lots of guidance, and it's just like a weird. It's because like I said, I was super healthy, super active, fit, yoga, dancing, all this stuff, and to wake up 10 days later and not be able to walk is like kind of a mind fuck. Like, yeah. Yeah. And that's the thing. Like it was so scary too. Cause it's like, I have this whole machine that initially when I first started walking, it would take like a team of 4 people. Cause there would be someone just watching me to make sure I didn't fall, someone pushing the cart, someone watching the cart. Like, eventually someone rigged up a whole thing. It was like one of those TV stands that you like in elementary school, like that they push in when you get to watch Bill Nye. It was something like that. Only it had like my IV stand and my 2 VADs on it. So I was able to just like, it was on wheels. I was able to just kind of pull it around. So once I got to the point where I was kind of like moving under my own intention. Like, and it is almost like being in school again. Like, you have to ask to go to the bathroom because you just can't get up and go on your own.
Right.
So once I kind of figured that out, that was nice to like, all right, the whole world doesn't need to know that I have to go take a leak right now.
Yeah. And so you're trying to learn to walk again. You're trying to do all these things again, but at the same time, they're trying to figure out what to do with your heart.
Yeah. Because it wasn't typically when a young healthy person gets this myocarditis thing, because it's just kind of a random occurrence. Like, there's nothing you can really do to prevent it. There's nothing you can really do to slow it down. It just sort of happens, and you typically crash and then bounce back. And they weren't sure why I wasn't bouncing back, and I was just on the VAD, and they were talking about like, oh, okay, like I was getting echocardiograms, essentially an ultrasound of your heart. I was getting those, regularly, at least maybe once or twice a week, maybe once every couple days, I don't know. And like, there was just no change. Like, my heart wasn't getting any worse, but it wasn't getting any better. And kind of the plan was like, well, it's been, let's say 3 weeks at this point. You're not getting any better. So I was presented with some choices where I could stay where I was and not do anything, which, wasn't really an option.
Right.
I could stay where I was, get listed for a transplant, or I could be put on a different type of BIVAD that would allow me to go home, which you kind of talked about. Like, I would have had to, sync up with the fire department and the local EMTs and make sure we had grounded plugs and backup power in case. Yep. And I'm like, I really don't want to do that. So really the best choice I could have made is what I did do was I got listed for a transplant. And since I chose to stay on the VAD as it was and stay in the hospital, I was pretty much at the top of the list the entire time I was listed. So I was officially listed, I think it was either the day of or the day before my husband's birthday that year.
Mm-hmm.
Yeah. So he was like, oh, happy birthday to me. My wife needs a heart transplant.
Oh.
Yeah. It was actually kind of nice, though. Someone from the kitchen, I don't know, I must have mentioned during rounds or something that, oh, it's my husband's birthday coming up, and it got down to the kitchen staff. So they had someone come up and ask, like, oh, we hear you have like a special occasion. Like, do you want us to make you some food? So they made us a pizza and a little cake and some salad, and they brought it up on like real plates. And, it was really cute. They had like flowers.
And that just shows like how like everybody working in healthcare can have like a difference. Like, you can be working in environmental services and be a janitor and make a difference. You can be in the kitchen and make a difference.
Oh yeah, all the cleaning ladies were so lovely, just like always smiling, like very nice to me. And I would try to like say hi and thank you when they would come and go, because it's like they have the worst job in the hospital. the very least you can do is like say hi and say thank you to the people that are cleaning your room every day, Right. But so I kind of got a little heat for requesting pizza, but it was just bad timing, because like this woman from the cafeteria popped in and she had a little notepad and was like ready to do whatever, and it was literally during rounds. So I have my doctors kind of standing at the foot of the bed trying to like decide what to do with me, and then this lovely woman trying to like make this nice meal for me and my husband, and like all I could think of was like pizza. Because she was like, are you sure? Yeah. Because again, this is still pretty early on. Like I'm on my whatever restricted sodium diet, and I'm not supposed to have this and this and the other. Eventually they lifted all my restrictions, and I was just eating. I would call Jay up and be like, McDoubles, chicken wing.
I'm getting a new heart, whatever.
Yeah, exactly, pretty much. Because it got to a point, it was like there was nothing that altogether that appealing on the hospital menu. And I'd been there for like a full month, and there's only so many freaking low sodium grilled cheeses that a person can eat before you start to feel a little bit tortured. So since my blood levels were all fine, they were like, as long as you're eating, eat. And this doesn't reflect very well on me, but I kind of made it a point to eat like just weird amounts and like random things, because I didn't like the nutritionist altogether that much. Because I found out she did this to another person I know who got a transplant, that when I got my tube taken out, the NG tube taken out, she was like, well, if you don't meet your calories, you don't meet your protein, we're going to have to put it back in. And at this point, like I haven't had to consent to anything. So I'm kind of thinking like she can just have them put a tube back in. And I was kind of losing my mind about it before one of my nurses was like, you realize like you're an adult. And if you say, no, don't put a tube in my nose, we can't put a tube in your nose. Right. And I was like, the nutritionist is being so mean. But it all worked out in the end. Like,
but that's a very negative way to approach patient care. Don't do that.
Yeah, but then it would be like, oh, I'm going to have 3 Oreos and 1.5 cheese sticks, and she's going to have to do math to figure out the calories. And like, just like petty revenge. Like, you know what? I'm going to make your job harder because you're.
I'm going to assert what little control I have over this terrible situation and stop being a bitch.
Yeah, I know. Like, come on. And I did have a really lovely social worker the whole time I was in. Her name was Kristen.
What up,
she
Kristen?
Was so Kristen. She was so helpful. And I just loved her to pieces. And I actually felt bad for her because my parents kind of were under the impression that her job was to be sort of a concierge for the family.
Oh God.
Yeah, so she was really going above and beyond her job to like, you know, she was helping them find resources to sign me up for additional insurance and find out about disability benefits and and like really her job was to like sit and talk with me and make sure I wasn't losing my mind. And she was kind of doing all these errands for my parents. And when I woke up and was actually able to like speak with her and talk with her, and she was doing her real job, which is taking care of me, my parents were like, yeah, that Kristen, like, I don't know what's up with her. Like, like we never see her and like this and that. And I'm like, well, the thing of it is, she's my social worker. So, you know, so I guess that's another tip for family members. Like the hospital team, it's not a hotel, it's a hospital.
Yeah.
You know, like end of the day, they're all here for the person in the bed.
Yeah.
You know, and if anyone's doing something for you and you're visiting or your family member, they're pretty much going above and beyond and like need to be recognized and appreciated.
Yeah. When you said there was a surgeon in your chest pumping your heart, was that initially?
That was between me passing out in South Shore and me waking up at Brigham.
Oh, okay.
So that was, I think that was when they were maybe explanting the pacemaker and putting the ECMO, installing the ECMO, or I think it was when they decided to install the ECMO was when I had my brief dip into
death.
Yeah. Yeah. Oh yeah, trust me, no one I know can get away with shit. Oh, you stubbed your toe. Oh, but did you die? You know, my husband got LASIK about a year after I had my transplant. He's like, oh, I'm really freaked out. They're going to cut my eye. Oh, they're going to cut your eye.
Did you get a new heart?
Yeah. Oh, I'm going to be able to see for the rest of my life.
So you get on the transplant list on Jay's birthday.
Yeah.
We'll get back on track. We're chatting.
Yeah. Let's get back on track.
And then what? How does that? What happens next?
And then it's just waiting. It's just waiting. Because for hearts, you need to match not only the obvious like blood type, but it needs to be the right size for my body. Like if an all otherwise perfect match came to be, but it was like a 6'5", 300-pound person, that heart wouldn't be the right size for my shape. Or if it was someone who was, you know, very petite, it would be too small. So
you're basically waiting for someone else to die?
Yeah. It gets to the point where like it's such a weird point right here, but it was like a half joke, like a head injury, like, it's like you don't want anyone else to die, but it's like I won't go home. And there's no timeline. Be there for a week. You could be there for a year. Like there's just you just don't know.
Right.
Which is like, it's hard. And I'm a person who likes to know what's going to happen. Yeah. So just, I was all ready to go, but for the fact that we just had to wait for a heart.
Right.
And I know my parents, again, with my social worker, they would call her directly and be like, do you know how long? Is she second? Is she third on the list? Is she fourth? And it's like, first of all, the list doesn't really mean shit. Like, because I was more or less stable. I was doing my
It
thing.
doesn't really work that way.
Then, the hard part was over for me. Waiting. And that's kind of when you start to just sort of lose your edge a little bit, because it's like, all right, no one can tell me when I'm going to be able to go home. Yeah. No one can tell me when I'm going to be better. No one can tell me when it's going to be over. Which again, with the whiteboard, like, please change the date on the whiteboard. Like that's like my only little finger grip into the outside world moving and changing is that date on the whiteboard. If you make plans, if you tell someone you're going to go visit them, do it. They have 4 months. They have 4 months to come see me, and some people just never did. And conversely, I remember every single friendly face that I saw.
Right.
Choose wisely. Someone brought me a rum cake. So I'm like, all right, rum cake, cool. I am in the hospital, though.
Like the idea, love the sense of party, love the optimism.
Actually, around the time that I received the gift of a rum cake, I had a case where there was a clot at the end of one of my VAD tubes, and it was on the internal part, so they did a quick ultrasound because they were like, all right, because one of the machines was sounding off all day, alarm. And then finally that evening, I think something else looks strange. So they investigated, and it turned out that there was this clot on the end of the tube that was in my heart. And I had to go in for an emergency surgery to get that clot removed, which I always kind of forget about, oddly enough, because it was such a blip.
Yeah.
But like it happened, and it's really it really is like part of the story, because it wasn't like.
It could have gone horribly wrong, but it didn't. So.
Yeah. Yeah. And again, right as I was slipping under, I apparently whispered to my surgeon, please don't cut me open again, which I don't remember at all. But he said that because they thought they were going to have to do a sternotomy to get in there to, like, maybe even just remove the tube and reimplant it. But he was able to somehow snake something up from the outside and suck it out without having to crack my chest again, which was amazing. I mean, because that would have been. So on the list, you can be 1A, 1B, 2A, 2B, or 7. And 7 is kind of, you're still accruing time, but you're not physically ready for surgery. So I would have been 7 until my sternotomy healed, ironically, in order to be safe enough to have a sternotomy. And that's a pain in the ass. You can't put your hands over your head. Yeah. It hurts.
Because you had a sternotomy initially, right?
Yeah. Mm-hmm. To implant the VAD, yes. And I had finally got the 8 weeks or 6 weeks or whatever, so I could, lay back with my hands behind my head and, get dressed and not have to worry about it. Sneezing was awful. Sneezing and laughing are the two worst sternotomy problems.
So how long was it before you got a heart, and how did you find out you got a heart?
So it was November 13th.
And this had initially happened in July?
Mm-hmm. Yep. I initially crashed in July. November 13th, my husband had brought me chicken wings. Shout out to Wings Over Somerville.
Oh, they're so good.
Yeah. Oh my God, delish. So he brought me wings, and one of the doctors came in, was one of the team. So it's not just one person they have, it's a whole team they have a heart failure team, they have a transplant team, which is probably what most hospitals do, but
yep.
It kind of makes a difference because tangent upon tangent, but there was a doctor that I didn't care for altogether that much, just long story. And at one point in October, I had been second on the list for a heart, and he was one to tell me about it. And just, one thing or another, I was like, no, I'll pass this one, which, and that's the thing, the second person almost never gets it. The first person 9 times out of 10 will say, yes, please put this heart in me. But, they have to inform the second in line, just in case there's something goes wrong, or the first person is sick, or whatever happens. But yeah, this doctor I didn't like came in and was like, hey, you're number 2. And I was like, get out of here. I don't want it. So one of the doctors I'm kind of neutral on, but it was more of a positive neutral, comes in, and she goes, you're going to want to stop eating that. I'm like, what? She's like, we have a heart. Your surgery is tomorrow. You're going to want to stop eating that. And I'm just like, what? What the hell are you talking about? She's like, I'll give you 10 minutes. You have to make a decision. So she leaves. I just turned to Jay. I'm like, blue cheese all over my face. I'm like, what the fuck? I tried calling my cousin, or I think I probably called my brother first. Either my brother or my cousin. I think no one picked up their phone, because it was maybe, it's kind of late at this, 9 p.m. on, I don't know, Wednesday, whatever day it was, middle of the week. And I'm finally like, holy crap, like I'm gonna get this heart, like I'm gonna be able to get out of here, like this is what we've been waiting for this whole time, like it's finally gonna be over. And and then I made a second round of phone calls, and I was like, hey, yeah, it's definitely happening. Like you guys can, like come up tomorrow morning. My surgery not till tomorrow. My parents live down in New Jersey, so it's like they had been sent home at this point because they really weren't helping. Yeah, my social worker, my wonderful social worker was she comes in and she was so sweet. She's like, if you ever need me to be the bad guy, I'll be the bad guy for you. And I was like, call my parents, tell them to go home.
Kristen.
Because it got to the point where they were just sitting in my room eating yogurt and reading magazines. I'm like, you're not even talking to me. Just go home.
It's like, I love you, but I love you so much. I want to love you from New Jersey.
They do say distance makes the heart grow fonder.
And my heart needs everything it can get right now.
Right. So yeah, the crazy thing about November 13th is my husband's grandmother, who is really his mother figure. She kind of did a good part of raising him. She passed away. She had a massive heart attack 15 years to the day that I got the news that I was getting my new heart.
Oh my God.
Yeah. Cause he had come in that day, and he didn't tell me this until after, but he was like walking around earlier that day at work or wherever he was thinking, oh wow, like it's Nan's anniversary. Like, wouldn't it be wild if today was the day that Liz got a heart?
Yeah.
And it was,
Nan was like, I'm going to pick somebody off and get Elissa a heart.
She's like, I got you. Right. And like, I'm kind of into that whole like spirit type stuff. So it's that's like my favorite part of the whole story.
It's kind of just like this beautiful serendipitous moment.
Yeah, exactly. Because it's even if you think like you die and that's it, there's nothing more. Like you have to appreciate this sheer coincidence.
Yeah.
Of those two events.
Yeah. So you stopped eating the chicken, and you said,
yeah, I did stop eating the chicken. I said I'll take it. People were coming in, I was signing a bunch of stuff, the anesthetic, whatever, someone came with a clipboard asking if they could have my heart for research. I said, sure. And we just stayed up all night, listening to music, just trying not to like freak out too much. And very wise girl, I played the song that I wanted to be our first dance at our wedding. And this is before we were even engaged. And I kind of look over and said, I always thought that this would be a really nice first dance.
Oh.
Because I'm like, if I make it, this is going to be our first dance. And it's Bruce Springsteen, Thunder Road. That was our first dance at our wedding. We listened to that the night before my transplant. And I told my boyfriend, who is now my husband, this is going to be the first dance at our wedding. And it was. You were there.
It was.
You can confirm.
I can confirm.
Yeah. So yeah, then I think 6 a.m. rolls around. People come in. They're like,
but first, I want to ask, like, what was that night like? Were you guys just apprehensive? Were you excited? Was it like?
It was kind of like, imagine it's like the first time you're going to go to like Disneyland, but you've never been on a plane before.
Okay, that's a great.
Because you're like, it's going to be great, but I'm nervous about getting there.
Yeah.
So yeah, 6 a.m. rolls around. The whole team comes in. They're like, all right, like, we're gonna get you ready. Like, I think. So yeah, I had been wearing my normal clothes, like sweatpants, comfy stuff, and to start doing some of the preparations for the surgery, they had me at least switch out of my t-shirt into a Johnny, but I had sweatpants on the bottom still. So they're wheeling me out of the room to bring me down to the OR, and she's like, oh, when you're ready to go, you just have the Johnny on, like, because I wasn't going to be coming back to that same room, so they wanted to make sure all my stuff was gathered. And I said, oh, sorry, I still have my sweatpants on. I still have my bottoms on. She's like, oh, well, why are you sitting there with your sweatpants on? You're supposed to be ready to go. And I go, no sweatpants. What kind of girl do you think I am? And like shimmy out of them, throw them at my husband. And like, he was like, that's the last thing I heard you say before they wheeled you down to the OR. Like, what kind of girl do you think I am? Like vis-a-vis, like not being nude from the waist down. So, because he's mentioned that. He's like, you know what? Like, like, thank God I didn't die, but he's like, if she had, that's kind of a funny thing, like the last thing I heard her say, you know? I'm like, oh gosh, we did a little like smooching and like, I love you or whatever, but like the last thing he actually heard me say before my surgery was this like throwaway joke about, you know?
Very true to your personality, though.
Yeah, and they bring me down. It was like kind of a quiet elevator ride down. Because half of the nurses had been in the ICU and sort of knew me and like knew what was going on and like getting excited. Like the whole night, like the night staff just kept popping in and like hugging me and like wishing me well. And because I'd been there for quite a while, so a lot of them got to know me a little bit, and I like to think some of them kind of liked me.
I'm sure they did.
Yeah.
We all have patients that we really enjoy and we are rooting for.
Oh, yeah. I think I was 25 in a cardiac ICU. Every other patient was like, either a, terrible middle-aged man with a, infarction or like an elderly person, very frail. So I was the only one with any like, feistiness. So.
Yeah. Yeah.
So they bring me down and I'm in the OR and they they have you say like what you're there for, and kind of very perkily, I was like, I'm getting a new heart. It was really funny because the tech or whoever it was, and I don't know, kind of looked around and was like, does that work? Is that okay for like legal purposes? Because I don't know if I was supposed to say like I'm receiving a transplanted heart or whatever, but
Your Honor.
Right? Yeah. Yeah, and then so right before they kind of took me down, they told me, they were like, oh, there's a chance that the new heart might not like take right away. Like it might not just immediately start going. So you might still be on an LVAD or BiVAD when you wake up, which I was like, what the fuck? Like the whole point of this whole thing is getting off the VAD.
Yeah.
But whatever, do the surgery, wheel me back up. Everyone's there. I, don't recognize that anyone's there. My cousin's husband, who I love very dearly, was holding my hand, and he thought I was like swatting him away because I was signing the letter J, which is like a little flick of your hand.
Oh yeah.
And finally someone was like, oh, I think she's trying to like spell something. She's not just trying to like swat you away. So Jay came over and I signed VAD, just VAD, VAD, VAD. And he's like, are you asking if you're still on the VAD? I guess I nodded. He goes, no, you're not still on the VAD. Oh. And he's like, oh, you just look so relieved. He asked if I was in pain. I guess I shook my head yes. And it was like, back off to morphine town for me. But yeah, and it was just like, you wake up and you have the extra tubes and cannulas and stuff, but it's just like days go by and it's like, all right, I'm breathing on room oxygen. Like, okay, like, all right, like I don't need the Foley cath anymore. Like, all right, cool. Like down to one IV, like, oh, cause I had, they had installed a PICC line, which is a permanent IV, more or less, or a long-term IV. Mm-hmm. For those of you who may not know. Because typical hospital procedure is you get a new IV every 2 days or 3 days. And if you're someone who has like really, really, really difficult veins, like I do, it got to the point I would see the poor IV nurse in the doorway and my eyes would just start watering. It was Pavlovian.
Oh, no.
Yeah. So they had to give me the PICC line, which they removed during the transplant. And I had to go back to the usual, like, sorry, just do what you can. None of them are good. They're all bad. It's not you, it's me. I have one good vein, one. Yeah, and it's like, eventually you're just down to like saline, walking around, doing your thing. And so I was in for a little longer than anticipated because they couldn't get my blood levels quite right with one of my medications. So after transplant, you take anti-rejection medications, which suppress your own immune system to prevent it from attacking this foreign body that is, your heart.
Right.
So I'm like, all right, yeah, they don't want to send you home with that. But at the time it was like, oh, God damn, like, please just let me go home.
Yeah.
Eventually let me go home December 2nd, which was...
Yay, right before Christmas.
Yeah. Because I had just been beside myself. Like, I don't know if you've ever been on steroids, but it's not a good time.
Yeah.
So I was just like melting down all over the place, screaming at nurses, screaming at people because after the first couple of days, they moved me from the ICU to just a regular, it's still a special cardiac building, but it was just a regular room. So I had all new nurses. It wasn't anyone I was familiar with. It wasn't anyone that was familiar with me. Mm-hmm. Those last 2 weeks kind of sucked. It kind of went from like 5-star resort to like a Holiday Inn. Like, it's fine. It's fine, but...
So you get home and then you have heart biopsies every year?
Well, right after the surgery, it's every week, and then every month, and then every other month, every 6 months, and a year. But knock on wood, I've been doing pretty much so well and have been so stable, and I had one episode of, so rejection is rated 0 through 4, 0 being nothing, 4 being you like are in urgent need of a new organ. I had one biopsy that came back with 1 R, but every other test has 0 R. So I actually don't even have to get a biopsy. I just have to do like the echo and.
How do they biopsy it?
They find an artery. So if you're lucky, they can get into your radial artery in your wrist. Mine hide, or actually no, hang on, I'm getting all backwards. So for a biopsy, just one done. That's all they need. They go in through your neck and they kind of snake it down. It's all X-ray guided, and they have like a little snip tool that they just pick little. I've seen them. It's like little fragments of the muscle tissue.
And they were doing that every week?
Yeah.
I don't know why that's what amazes me.
Because, it's like...
It just seems so invasive.
What can you do? Like, they give you a little shots of lidocaine in your neck, and away they go. And that was the thing. So if someone's on an operating table saying, ow, that hurts, that feels sharp, odds are what you're doing to them hurts and feels sharp.
Yeah.
So please don't say, no, you're just feeling pressure.
Right. Yes.
Like,
give me more drugs.
I am an adult. I can tell the difference between someone pushing on my neck and someone threading a needle into my neck, which is what you're doing.
Yeah.
Doctor.
Yeah.
And then for your biopsy plus cath, which they just kind of snake a little thing into the different chambers of your heart to measure, they say pressures, so I don't really know. Like blood pressure, I don't know.
Like filling pressures and pressure inside the chambers.
Yeah. For that, they need to find artery because they just need to be able to get into all parts of your heart. So since my wrist arteries are too tricky, they have to go through my femoral arteries, which poses some additional risks, but it's like they just can't find my radial arteries, so that's what they have to do. Mm. And that's they only have to do that once a year, if that. And like I said, since I've been pretty stable, I don't have to go next year. And at year 7, if all is well, then I don't need to get an invasive biopsy until year 10, and then 15. And then I think it'll just be every 5 years until whenever, which is pretty good.
Did you ever find out who your donor was?
No, so the way that it works, at least in New England, at least for this, is there's an organ bank. It's a kind of centralized. They facilitate all the who's getting what, and I can reach out to them to say, hey, I'm an organ recipient, but unless my donor's family has also reached out and said, hey, like we're a family, we want to know, like both parties have to want to meet. And so far I haven't reached out. My whole kind of hang up is like, I feel like I need to like do a little more, I don't want them to think like, oh, my brother, sister, cousin, loved one passed away. And like this chick just fucking, does yoga and eats Cheetos and watches cartoons all day, but that's kind of just my personal hang up. I feel like, and also I get honestly so weirded out and just a little creeped out by those viral internet videos that are like, oh, he got her father's heart, so now he's walking her down the aisle of her wedding, or this mother got to listen to her son's heartbeat one more. I'm like, don't touch my chest, please. Like, I don't want a stranger's stethoscope being my,
it's completely a personal decision.
Yeah. I'm sure a lot of people find it maybe very empowering to kind of say like, look here, I'm alive. Thank you so much. But for me, it's more of a case where like, I just, they gave everything. Because the heart's kind of the last thing they take. And they mentioned like, oh, your surgery is scheduled for this time, but it might be pushed back if the other stuff doesn't go smoothly as it should. So as far as I know, like, corneas, whoever else has reached out and they're just waiting on, the to phone home. But I don't know, it's like I'm very kind of irreverent and like, I just wouldn't want them to be disappointed. I wouldn't want them to be like, oh, her, like, she's okay, but
I guess that's a big, like, kind of, I wouldn't say burden, but I feel like that's a lot of pressure to have on your chest, I guess, to be like, oh, I'm carrying on the life of someone else.
Yeah.
But at the same time, like, if you're the family member, be like, oh, their organs went to someone who's young, and regardless of what they're doing, they get to live their life, as opposed to someone that's older. Not that there's value in life based on age or whatever, but it's like, if it was a donation of someone that was my loved one, was like, okay, it's a young person. They get the most out of it. They get the most miles on this thing.
Young. Like, they really do a very good job of, protecting everyone's identity unless everyone wants to know.
Right.
Because, like, I don't even, the New England region it's like the entire, it's up to Maine, it's so I do know how they died, but it's, without going into too much detail, it's not something that would be very easy to Google and like get a reasonable result. Yeah. So, yeah.
So then you're home. What has life been like with like a new heart, and what have you been doing?
I got home. It was December 2nd. We rolled right into Christmas. We rolled right into New Year's, right into my birthday, and then my husband's aunt passed away. It ended up kind of slowing me down for a little bit. I didn't really start making moves until about 2016, which is when I have got up and enough to even attempt to go back to yoga, which I really loved. So I took my first yoga class after my transplant in June 2016, and I started a yoga teacher training that September, because I'm like, what am I going to do? Like, so I decided to pursue yoga teacher training, kind of not only to both, it's something that I felt very passionate about before I got sick to begin with, and also, it's something that I would rather do than an office job, or, I mean, like, what else is there? There's office jobs, and then there's like retail. I mean, I don't know. I want a job where I can sit down and where I don't have to talk on the phone. So A+ yoga teaching. At EO Yoga, if you're interested, on Instagram.
Yes, I'm going to share everything because it's really awesome. And you're out there rocking your amazing scar on your chest.
Oh, yeah. I kind of joked about that with one of my nurses. I was like, I've got all low-cut shirts. Like, I'm not trying to buy a whole new wardrobe. I'm just going to be like, I'll let it air out. I don't really care. and actually, I've only been asked about it once. It was actually on my honeymoon. Some like random maintenance worker in the hallway was like, "Oh my God, like what happened to you?" So, and it's like, this all happened, but like I'm on a beautiful, amazing vacation, in Punta Cana. So end of the day, clearly it all worked out for the best. So
yeah, clearly.
Yeah.
Well, we've been going on and on chatting, but I guess, so I didn't know you when I was hearing about this entire crazy story, because my good friends was one of your good friends from college and everything. But I remember hearing the entire time about Jay has been by your side the entire time, and Jay is fantastic. I guess we'll end. I mean, the whole story is like an amazingly positive story, which is a wonderful change of pace for my podcast.
And like, don't get me wrong. There have been, dark days, dark weeks, dark months. I mean, hell, like 2014 was fucking awful. But, kind of like what I said at the beginning, like, it's kind of that human ability to like separate. You can kind of compartmentalize and like, all right, for 5 minutes, I'm not going to be on life support. I'm just going to watch fucking Rachel Ray and like chill out, or like I'm just going to. Once I got yelled at because I had to request a bolus of morphine because I was laughing too hard at my husband and my brother, who were just goofing around with each other. All three of us got a little talking to. She was like, "Don't make her laugh. She just had a heart."
Oh, I was going to ask a feel-good moment at the end, but my question is, what do you have to say about organ donation and people being...
Oh, I mean, I was always registered as an organ donor, even before any of this ever happened. Like, you can't take it with you. It's not going to do you any good, And I understand some people have religious objections, and I'm not going to touch that. But like, you can help so many people. You can just it's like, again, and also the whole stereotype or the whole information that, oh, if you're listed as an organ donor, like they don't try as hard to save you. Like, it's so not true, because as you heard, I died. They could have had everything. I was at the top. I was so healthy. They could have had grade A kidneys and shit, and they didn't. They saved,
Yeah, that's true.
So, I mean, I think I pretty much convinced everyone that I know personally to register. You just check a box next time you get your license renewed. Like, and it's like, you hope you never have to receive one, but in the event that you do need an organ, you want there to be plenty of people out there who are willing to let you have one.
Yeah.
Or families that are willing to, have their loved ones kind of live on and, kind of end, their life is over. And that's, if someone's organs are healthy enough to transplant, the chances are that they died in some very tragic way. And it's just, that it's probably the biggest tragedy in that whole family.
Right.
But it turned into like the most beautiful thing that's happened to mine.
Yeah, I'm an organ donor. James, my boyfriend's an organ donor.
Mm-hmm. Yeah.
And I'm probably going to cut this part out, but when I was getting divorced, he is not an organ donor. And
Ooh, boo.
And he was dragging his feet, and I was like, with the divorce, and I was like, hey, you better sign this paperwork because I'm your next of kin. If anything happens to you, I'm donating all your organs.
Oh my God.
I don't know if any of our old mutual friends listen to this podcast, but so to end on kind of a happy note, how did Jay end up proposing?
We go down to the Cape every year, and my parents have a timeshare down there, and they let us use it for a weekend every October. So we had gone shopping together. We had looked at some diamonds, and I was like very excited. This is maybe like June that this happened, and then I don't hear anything. I'm like, well, year? Fuck it. I guess he's not. This is 2014.
Oh, okay. So this is like right after the.
Yeah. I know I said the whole year 2014 sucked, but
not the whole.
Overall, it averaged out to suck, but this moment was quite nice. So he bought it and like didn't tell anyone. He didn't tell anyone. I think even his dad knew that he bought the ring. And over the summer, we went to visit my parents. He asked my father for my hand, and he had just been like sitting on this ring, I guess, waiting for a moment. And we were down the Cape, just sitting around, and he was like, oh, we should go for a walk on the beach, or, some woman in a shop had recommended this like scenic vista. And I'm like, it's like 65 degrees out. It's raining. I'm not going to go for a fucking walk on the beach. Like, you're out of your mind. You're supposed to be doing homework right now. Like, I don't even want to talk to you. Like, we're wasting so much time. And I like turn around, and he's on one knee with the ring box. And I just speechless. He like said some very beautiful things about how much he loves me. And I don't even think I said yes. I just grabbed the ring and put it on and was like bawling. Like, yeah. And then, my dad showed up about an hour later, and I'm like, like clearly we've both been like weeping. I'm like waving this giant diamond around, and my father's totally oblivious, like doesn't even see it until, and like I was calling my brother, I called my mom, no one's answering their goddamn phones. Finally my mother calls me back. She's like, what's going on? I'm like, Jay and I are getting married. And then my dad turns around and he's like, wait, what's going on? It was just so nice, and just, he's just so cute and nice. Like, I can't even
he is a great guy.
Yeah. And it's nice that he did it there, because we go back to that same room every year, and we sit on the same couch where we got engaged every year. Yeah. I know it's not like that exciting, but that's how it's kind of us. Like, we were just sitting on the couch, like just like with each other.
But it's a beautiful, after all of that, for everything you guys went through together, and how supportive he was. And I mean, that strangers that didn't even know you heard about how supportive he was. It's really wonderful that you guys had each other through all that. I mean, I'm sure it made it a terrible time a little bit easier to go through it with someone that you love.
He was working part-time, going to school full-time, and was in the hospital every day. Like, literally every day. He saw me every single day for 4 months. He drove into Boston. he paid for that parking every day.
Imagine how big the ring would have been if he didn't pay for parking every day for 4 months.
Right. Ah, damn. Yeah. And he made Dean's List that semester.
Holy shit.
Can you even imagine? And I think it's just he was probably just so fried that it was like when he was at school, everything else turned off. You know what I mean? When he was at work, everything else turned off.
Yeah.
So he could actually focus for once. But yeah.
Well, is there anything else you want to talk about? Anything else that we didn't touch on?
Just kind of general, like if you are let the person who's sick, let the patient kind of guide the vibe and like guide the conversation. If you're, a friend, family member, or even to some extent a medical professional, like if you walk into the room and like I'm, if I'm smiling and happy to see you, like return that energy. If I'm like sad and unhappy, like recognize that, emotions do play a factor in physical health and like how you feel.
Yeah.
Really, they have a Reiki team up at Brigham, and I have since gotten my own Reiki certification because that was so helpful. Even just having 10 minutes of the day to just sit and kind of listen to like pleasant ambient music and breathe. Like even if you're not into energy work at all, even if you don't believe that it's real, like you can't deny that your emotions and your mentality play a part in how your body physically reacts and physically heals itself. And
yeah, of course. I think we're starting to learn that and focus on it more. We can do so many things to save the body, and we have all these great drugs, but we need to be more cognizant of the mental aspect of it. And we could go on for hours talking about that.
Yeah.
But that's a really great take home for everybody, whether you're a family patient or us in the medical world.
Yeah. And even just like out and about in your real world, like, I've had a lot of people at family parties, like friends of family, like friends of aunts and uncles come up and like, they just jump right in with like, oh, you had the heart transplant. You're such a miracle. You're such an inspiration. I'm like, you don't know my name. Like,
yeah,
like I'm a human being first before I'm like someone with this thing that happened to me. You know what I mean? Like it's very off-putting to all of a sudden be like, oh, I'm the miracle girl because I got fucking sick. Like,
Yeah.
I mean, I don't know. That's also just me too, which again kind of recalls back to like, that's who I am. Like I don't very much care to be defined by like the worst 4 months of my life. You know what I mean?
Right.
I think some people kind of like to sit in it and sort of make their lives about the transplant or about the illness or about whatever they're going through. But my kind of perspective is like, I'm just going to try and float on top of it. I'm up here, I'm breathing. I might be treading water still a little bit, but like, I'm trying to have a good time. And that's me,
I think you're definitely doing a great job. I mean, you could definitely kick my butt in yoga. And I think when I started doing yoga, I texted you and I was like, what are all these words? And what kind of yoga mat should I buy? This is really great, but I don't know what I'm doing.
Yeah. If you happen to live in South Shore, Boston region, I teach a lot of yoga I call it yoga for people who hate yoga. Because it's kind of that my whole experience of like, let's not make a deal about this. Let's just try to get through it.
I wish you did like online classes.
Right?
I would totally take like a virtual class with you
someday.
Watch videos or something. And to plug your yoga again, it is
my Instagram is E as in echo, O as in yoga.
All right. Well, thank you guys so much for listening. I know this has been a longer episode, but I didn't really want to cut too much out just because Elissa has such an amazing story. And I think it's all really, really important. If you want to get in touch with me, you can follow me on Instagram at Antidotes Podcast. Twitter is Antidotes Pod. My personal Twitter is Christine the NP. And as always, Facebook is Antidote Stories in Medicine Podcast, but there is the great Facebook group, Antidote Stories in Medicine Podcast group. Thank you guys so much for listening. I will be back next week with more stories. Have a good one. Bye.